Hello everyone, I am Jeannie Manuel Rectra and I will be discussing with you my Capstone Summary in NLM 200 Nursing Leadership Management. My capstone talks about fall prevention among the elderly. But before we talk about fall prevention, let us first know what is fall and why falls among the elderly are an issue. According to the World Health Organization, a fall is defined as inadvertently coming to rest on the ground, floor, or other level, excluding intentional change in position to rest in furniture, wall, or other objects. Today, serious fall injuries among Canada's senior population are dramatically increasing and have become a public health problem that could reach crisis proportions. It is a widespread occurrence for seniors to fall that poses a risk and enormous threat to their well-being and quality of life. According to the Government of Canada, it has been found that falls are the leading cause of injury among older Canadians, with 20 to 30% of seniors experiencing falls more than once each year. Data also shows that 85% of seniors' injury related hospitalizations are caused by falls. Adverse consequences of falls for the elderly reduce their quality of life, increasing their fear of falling and restrict activities, decrease their ability to function, increase the risk of death, and acquire serious injuries and trauma. This is the reason why falls among the elderly have become a threat that needs to be addressed. As future Canadian healthcare leaders, we must prevent falls from happening among older adults by coming up with recommendations and interventions in averting elderly from falling. There are various strategies to be done to prevent the elderly from falling. Fall management program for nursing care facilities is one of the strategies to be developed that provides an individualized, patient-centered intervention and improves fall care strategies and outcomes through education and quality improvement tools. Nurses working in the long-term care facilities must assess and screen their residents upon admission every quarter, every year, and/or change of condition of the residents. Nurses can use the three-question approach and/or staying independent checklist, where the nurses ask whether the resident has fallen in the past year, and if yes, it is followed by the number of times the resident has fallen and if he or she has sustained any injury. Then, follow-up questions for the residents are if they have unsteady gait when they stand or walk and whether they are afraid of falling. Assessment must be done because it is the key to the identification of whether the resident is at high risk for falls. In implementing this program, I have chosen to adopt a participatory leadership style that values and incorporates the opinions and suggestions of others. Decision-making processes value knowledge, skills, experience, and innovation, including expertise and engagement from a variety of sources. Effective open communication is vital during the implementation of this program because it supports discussions about the program process and resident safety. It also discusses difficulties in implementing it and direct staff care. It is expected in this program that healthcare settings like hospitals, retirement homes, and long-term care facilities will be supported in delivering tailored client-centered care. Fall prevention procedures and the reduction of falls among the elderly are also expected to improve with the use of education and quality improvement tools. In order for this program to sustain for a long period of time, nurse managers must get support and funding from the government. A sustainability model is developed to support nurses and other healthcare leaders in introducing sustainable initiatives in improving the quality of care and patient service experiences. This model helps nurses in the identification of strengths and weaknesses and the assessment of the likelihood of sustainability. This includes tools to conduct an in-depth examination of the experiences of point-of-care staff and senior and clinical leaders involved with healthcare organizational change. The model can be used to self-assess against key criteria for each of the 10 factors. Self-assessment is recommended at several points when implementing a guideline. During planning, self-assessment is used to identify areas that require initial enhancement. At the pilot testing stage, results indicate which factors require strengthening in the implementation plan, and finally, the assessment is repeated during guideline implementation to ensure conditions are optimal for sustainability. Another method is the mentored guideline implementation framework. The purpose of the mentoring intervention was to reduce fall rates and numbers of serious falls through enhancing sustainability action planning, providing ongoing feedback to implementation teams about patient outcomes through collection and analysis of quantitative data, identifying barriers and supports that occurred in the implementation of the guideline through collection and analysis of qualitative data, and providing education and networking opportunities for leaders among the healthcare setting. The next slide is a list of the references I used for my capstone. Thank you very much for listening and have a good day.